Dear moderators, dear organizing committee, thank you very much for the nice introduction. Thank you, organizing committee, for inviting me to this amazing global event. It is a big honor and a pleasure for me to speak to so many colleagues, pediatric dentists from all over the world. Dear colleagues, hi from The Hague, the Netherlands, the country where we recently published the new guidelines of pediatric dentistry for treatment of caries, where the first priority and the most attention is being given to caries as a behavioral disease. Yesterday and earlier today, the focus of the presentations was going to the different methods and the best techniques to treat caries in the teeth and to prevent caries in the teeth from developing. However, in the whole puzzle, one important piece needs to be added, and I would like to add that piece of puzzle is connecting all of them together, it's holding them in place, and is making the other methods more sustainable and more successful. We need to team up with the parents for better treatment of caries in children, and for that we need communication. Can caries be treated with communication? Is that possible? Here I would like to share you a story. A few years ago, a little naughty girl of 4 has been referred to me with the question, is general anesthesia here necessary? Because treatment of the cavity was not successful. The girl did not allow that. The girl didn't want a filling, and the mother found a whole crown completely out of the question because it did not fulfill her aesthetic needs. So we sat down with the mother and we started talking. How is it possible that this girl developed a cavity? And after some moments, it became clear which diagnosis is here. The girl loved sweets very much. And of course, the loving parents were spoiling her with that. The girl did not like brushing her teeth. So of course, the loving parents were not pushing her to brush the teeth and were leaving like that. And then in the conversation with the mother, we were asking several questions. What is love? And what is care for the child? What is important for the future of the child? And then the mother made some decisions and started working on them, started working on her goals. In the process, she came a number of times to our prevention assistant to learn how to cope with the child and how to brush the teeth. And one of these sessions I have seen from the distance, the arms and the legs were going around like a helicopter, and the girl was screaming really aloud, how do you dare to do something what I don't want? But the mother was still trying to do her best under the calm guidance of the dental assistant. And finally, she was successful. She managed to change the behavior at home. She managed to limit the sugars. And in the meantime, the girl managed to accept the treatment with SDF. So within a year, the cavity was completely stopped. It was hard as glass, and the girl at home was becoming more happy because she knew the boundaries. Still, she did not accept the treatment of the cavity by filling, and it was not necessary. So we decided to go on in this way. After one more year, the cavity was still stable, but at that moment, I decided to give a little reward for the mother. So we made a surprise with the girl. She allowed to make the filling, and then we could say to the mother, look at this. This is something what you achieved with your hard work. So the threshold in making a filling in my practice is quite high. I only make a filling if it is necessary to prevent infection or pain, or otherwise if the situation is such that the child or the parents really need some support. That is also what in 2012 Edwina Kidd asked in her article in Dental Update. Is it really necessary to restore the primary teeth? So in some cases it is necessary, and in many cases it is not. It depends on the circumstances. Here I would like to share another story with you, a story of a girl of 2 years old that has been referred to me because she refused treatment of the cavities at her own dentist. And just look at these teeth and think, what kind of feelings does it call for you when you see the situation like that? What kind of thoughts do you get? And what do you want to do? In this situation, the mother was very kind and very gentle, and she didn't know how to cope with a girl with a strong character who is very afraid with a dentist. The girl was getting baby bottle at night because otherwise she would cry, and the mother didn't know what to do if she was crying. The girl didn't allow the mother to brush, and the mother did not have the skills and the confidence to cope with a girl of that age which does not want something to be done with her. So if we compare the situation to a metaphor, a parent is bringing something very precious that is broken to a specialist, and they expect that the specialist will fix it. What are you going to do with this? Of course, we have learned how to fix the things, and we can do that, and we can make a beautiful work. But did we have a look at the background? So here I would like to talk about the writing reflex. The writing reflex is something what we all have, the parents have it, but especially people in the healthcare professions. This is the reason why we chose the healthcare, because we want to help people, we want to make them better, and this is with our best intentions. I can compare this to the parents who are helping the child in their play. Of course, the intentions are very best, and the parents know where all these little pieces have to go to make it according to the instructions. But what happens in this situation? The parents are doing the work for the children, and the children are sitting at the sideline completely passively because they are not participating in this, maybe participating in a small part. But if we manage to suppress our writing reflex, if we manage to go to the sideline and let them solve the problem, then look what happens. In the long run, they learn how to use their creativity, how to solve the problems in the way that we probably never have expected. This is also stated in the United Nations Convention on the Rights of the Child, where it is said that in all actions that are concerning the children, the best interest of the child has to be taken in consideration. Also, the parents and guardians have the primary responsibility for upbringing and development of the child. And in that difficult task, all the institutions, parties, and everybody involved need to give them appropriate assistance to learn the skills how to cope with child rearing responsibilities. So what were our first steps in this case for the little girl of 2? Instead of starting with fixing the teeth, we referred the mother to the social worker to improve the skills of child rearing, and we also supported the mother in learning how to brush the teeth. We trained her toothbrushing skills. Because having healthy and clean teeth is a basic right of each child, and the research shows that when children start going to the dentist from the very young age, they have a significantly higher chance to have a better oral health. So how do we get young children to visit a dentist at a very young age? That's a question where we probably have to cooperate with other institutions. We will not be able to solve this alone as a dental community, but for that we need good communication. And then when the children start coming to the dentist at the very, very young age, what do we do when we see this or that, or maybe that? Do we try to fix the teeth? Or do we try to fix the child for the parents? Or do we address the parents and try to support them in changing the circumstances, in changing their lifestyle, in their skills, so that the natural healing in the teeth will occur? So where do we start? At the dental school, we learned many technical solutions, how to fix the teeth. We also learned how to give advice to the patients, and we learned that we are responsible for fixing their problems. So no surprise, we have the writing reflex. We also learned art and hole technique, or the minimally invasive techniques to restore the teeth, and we started using SDF. But are these technical and medical solutions enough? Is giving advice enough? Is starting with fixing the teeth the right way, or do we need to look broader? Do we need to start with something else? Research shows that giving advice is not enough for behavior change, because parents often know what is necessary. They know about brushing and about sugars, but life stands in the way, and implementation of self-care, seemingly simple, is not easy to implement. Parents experience a lot of stress and a lot of obstacles in their daily life, and that is shown in different studies. You can read that. And that has also a big impact on the oral health of the children. Just think about the current pandemic, the current COVID situation. What kind of impact does it have on the families, on the stress levels, and what impact does it have on the health of the children? Caries is a behavioral disease. So if we want to treat the cause of caries, we need to address the behavior first. Of course, we need to treat the symptoms of the caries simultaneously at the same time, and we need to find the priorities. What needs to be treated first, and what can be left for later time, and maybe something we can only monitor and we don't need to provide any treatment. There is a statement, behavior change in pediatric dentistry starts with the parents. We need to start the behavior, changing the behavior of the parents. Is that right? I think we need to look even further. The behavior in pediatric dentistry starts with the mindset of the dental professional.
Do you dare to give the control of caries lesions out of your own hand, or do you feel that you are the one who is responsible? How strong is your writing reflex? Are you the dentist who believes that caries stops due to your efforts? Or are you a dentist who believes that caries stops due to the efforts of the parents?
There is also a locus control of the patient. Some people have external locus of control and they don't believe that they can solve the problem. So they think, I believe that caries stops due to the efforts of the dentist, and they bring the child to the dentist to fix the problem. They think that there is not much what they can do themselves. And some of them believe that caries is in the family, so there is absolutely nothing what can be done. And in the other families, when you find that something went wrong in the teeth and they have enough self-confidence, then when you tell what is possible and they have made a decision, they are sure that they will manage. So it depends on what kind of person that is in front of you. Some people are uncertain and some people have self-confidence. So when a person with low self-confidence and uncertainty is coming to the dentist who thinks that he or she is going to solve and to fix the problem for the patient, what happens is that their uncertainty becomes even bigger. But if that person comes to the dentist who is not trying to fix their problems, but invites them to do it together and says that I will help you to solve the problem, their self-confidence will go up. So which kind of dentist are you? And what kind of signals are you sending to the parents, not only verbally, but also non-verbally? For example, in my practice, I started changing the place with the parent, and I went sitting on the chair of the dental assistant. And that gives the non-verbal message to the parents that I'm not important here. I'm just helping. The most important person in treatment caries is the parent. And that is very pleasant for the child because it is very trusted and the whole treatment is taking place not in the clinic but at home. So how do we achieve that the patients want to come for our trainings so that they want to change their behavior? What techniques do we use? We know that a method from addiction treatment, motivational interviewing has been successful in changing the behaviors, especially in the difficult cases. It also has been used in other lifestyle diseases, such as eating disorders and obesity. And also it has been studied in the oral health care. Recently, a number of articles have been published, and they showed a success of motivational interviewing. Caries risk has been lower. It has been affected in the families with lower income. It improves the effectiveness of the health education. It changed the behavior. It changed the knowledge of the parents. But it is important to remember that motivational interviewing is a skill which needs proper training and enough practice. So please, if you want to practice motivational interviewing, find a course, find a good training in your area. Maybe you would like to buy a book, or maybe you would like to go into an online course. I myself went to the course of Stephen Rolnick, but I also followed a course online of Stephen Rolnick, and I would recommend it, even though I don't try to advertise it. But I found it a very useful course because step by step, you can develop each technique, each little detail of the conversation. So what is motivational interviewing? Motivational interviewing is first of all a conversation. It is a style of talking, of communicating with people, and not a technique that you use on them. It also is not being done on the patient, but being done together with the patient, and where the patient is sitting in the driver's seat and is the person who is doing all the work, and you are sitting on the passenger seat as a skillful guide, as a skillful driving instructor, and helping the parent or the patient to learn how to do things differently and how to take control of their own life. So this is the definition of motivational interviewing by Stephen Rolnick, which he provided in the course, which is presented online. And in the dental practice, you can see the same situation. If you are the one who is sitting on the driver's seat, the parent will become passive. But if you invite the parent to sit next to you, and maybe you invite the parent to change the places with you, so that the parent is on the driver's seat, on the dentist seat, is taking the main role, then non-verbally you give a signal to the parent that they are most important and that they are going to solve the problem themselves if they want it, and we are going to support them. There are a couple of important principles in motivational interviewing, and the first one is that we cannot change people. People can only change themselves if they want to. And principle number 2 of motivational interviewing is that it is not what we tell the patient that matters, but what we hear the patients say themselves that makes a difference. People get convinced by what they hear themselves say. So stimulate them to talk about their own change. This is our task during the conversation, to help them to talk about their own change. And people need to believe in what they choose, and they need to believe that they are making the change themselves. That it is not we who make them change, but that they have decided to make that change themselves. Our task is support them in making that decision. There are several dimensions in motivational interviewing, and they're all intertwined. They are all going at the same time together. So it's like driving a car. First of all, you have a mindset. This is something what has to do with you. Then you learn the skills and you apply them in everyday practice. And at the same time, during each conversation, you go through certain stages, through certain processes. We will start with the mindset. How does your daily practice look like? Do the patients come one by one, like on a belt, the items that we have to fix? This is how our healthcare system is made up. A patient comes in, we fix the problem, and then the next one comes in, we fix the problem. The next one comes in, and we fix the problem. And it is very difficult to even think of them as persons. Do we have curiosity about them, about their life, about what happens in their life, and how comes that they got problems? Your mindset is also to see what people have that they are capable of, to find their strengths and not the problems and not what we need to fix. We need to find what they can do, what they can achieve. So see them as people first, not as patients. They are all unique. They have strengths, not only symptoms and not only problems. They appreciate choice and they appreciate autonomy so that they can choose what they are going to do themselves. And these people too, and these people too. So look at different families. They are capable. They all have certain creativities and certain strengths. And they are capable to achieve their own goals. So in your mindset, work with the people and not on the people. Build a working relationship. Declutter your mind. Don't be clever. Don't try to think what you are going to say next. What are you going to do on them? Just focus on the people and see who is sitting there in front of you. What kind of person? Let go all your judgments. Let go of your writing reflex and let go of being in control. Just focus on the person. Have empathy and try to understand the person in front of you. If you change the mindset, you will become a guide, an assistant, not somebody who is telling people what to do, but somebody who is supporting. So you have a current situation and you think of a goal, but this is your goal and not the other person's goal. It is very important that you find a goal together, that you agree on that goal, and that you find a path together, that it is not your path, but it is a path that you are looking together, how to solve the problem. What Stephen Rolnick said, your mindset should be, I guide, you decide. So it's not you who is deciding what and how is going to be done. And then you might choose different ways to better health. And each way is good. Each way is the right one for that person. It is not you, but it is the parent who is solving the problem. You are just supporting. We have a question why people don't change if we advise them, if we say what is good. It is because people have different thoughts in their minds. And of course, they would like better health for the child. Of course, they know the reasons why they would like that, but at the same time, they see obstacles. They know what stands in the way. And then they come into a certain situation where they hear the voices for the change and against the change at the same time. And this is what we call the change talk, everything what they think or say for the change, and the sustained talk, everything what is an obstacle, what stands in the way of the change, and everything what they say why they don't want or they can't to change. So these voices is just like a meeting in their head, like in the upside down film. What is happening in their mind and which voice is prevailing? And what happens when that person has these thoughts? These persons, these people usually have difficulty to decide something, and this is what we call ambivalence. And when the ambivalent person comes to the dentist, and the dentist starts to give advice and to convince what they have to do, starts nudging because it is very important, because it is better for the child. Think of a number of reasons why you try to advise the people to do something, to brush the teeth better, to stop with the sugar. What happens? You are trying to push, and then the people start thinking, why is it not possible for them to do what you advise? They see obstacles, they see problems, and that backfires, and the people start thinking more about their problems. These thoughts start prevailing in their heads, and then what happens is that they visualize it, and when they come home, they only remember the reasons why they don't want to change, not your advice, but things that stayed in their head. They did not manage to internalize your advice, but they enhanced their sustained talk. So the chance of changing will become lower. And who has caused it? It is because we pushed, we enhanced their resistant thoughts. On the other hand, if the dentist tries to understand the person, tries to understand their life situation, and they are saying this, that of course, on one hand, I understand it is very difficult for you because of this, of that, but on the other hand, I see that you would like to change or to do something. Tell me, why would you like to do that? And the person starts telling you themselves, yes, because I would like this and I would like that, and then you will encourage them to talk more about their change. So what happens is that their change talk will grow, and they will develop thoughts about the other behaviors, the better future, and they will go home and they will remember that positive experience and what they have decided and what would they like to achieve. So they manage to internalize the positive goals. So the most important skill of a guide or a health professional is to listen, to hear what is the person saying, what are the both sides of the equation, what kind of words or phrases is the person or the parent saying about their willingness to change and about the obstacles. And try to listen not only with your ears but also with your eyes. Observe the person, give undivided attention, and listen with your heart. And when you are listening, it is important that you try really to understand the person, not give your judgment, but understand why they are saying something. You have no intention at that moment to advise or to fix anything. You sit back and you offer no resistance. Because the person is like an iceberg. You see only the point of it, but when you really listen, you see everything what is under the water. And what do you hear when you listen? You hear certain words. You hear the sustained talk and you hear the change talk. And then you can find out in which stage of change is that person. About this, you can read more in the books about motivational interviewing. I just tell you that your goal in the conversation is to stimulate people to say more things about their own change and to avoid them saying things what would keep them in the current situation. So try to limit the sustained talk and to increase the change talk. And how do you do that? How you increase the change talk? For that, we have motivational interviewing skills. There are 4 main skills of motivational interviewing. They are called ORs, and I will tell you in detail about each one of these skills. So the first skill is asking open questions. There is a difference between closed questions and the open questions. The closed questions are usually answered by yes or no, and the open question is like an open door. You don't know where you end up. You don't know what kind of story the person will tell to you. And here are several examples of these questions. What do you think of that? What is important for you? Why would you brush your teeth? How do you think you can achieve that? So in the dental clinic, in the dental office, when you have colored the teeth, instead of starting to explain what it is and what you see, you can start with asking questions. What do you think this is? And what do you think the colored places here are? And how did it happen that despite your effort, there are still bacteria on the teeth? On a scale of 1 to 10, how would you evaluate your own brushing? And which score would you like to achieve? And it is not important which score they want to achieve, but why. So ask the question, why would you achieve that score? And then in this way, you will increase the change talk. The people will try why it is important for them to have cleaner teeth. And what do you do when the patient has answered your open question? Are you going to ask more and more and more questions? Beware of interrogation. Don't ask too many questions in a row. And this is definitely not the time to give any advice. What is very handy is to think of one well-formulated question, and you can ask it for most of the patients. For example, what are you doing to keep your child's teeth healthy? And into this question, you will get a very interesting details what they are already doing themselves, and you can keep it positively because you can give an affirmation or a compliment for all the things that they are doing well. And after they answered the question, before you ask another question, it is important to give a reflection. So to show the person what you understood from their answer. So everything what the person is saying is a kind of statement, but it has a meaning. And that statement comes into you, you hear it, and it goes through your empathy, through your understanding, and then you try to give it back to the person. That's a reflection. A reflection is always a small summary of what you have just heard. It is always short and simple. It is neutral. Your opinion is not important here. It is a statement and not a question. And it is all about them and not about you. So it starts with you. It is an attempt to guess the meaning and the emotion of the person. So here are some examples. The mother says, I always give him a candy when he asks for it. Why does the mother say that? You find it difficult to say no. You want to give him a pleasure. Yes. You would like him to be happy. Yes. And now he has cavities. Yes, suddenly the tooth started hurting. You are worried about it. Another example. I stop with brushing when he starts crying. You find it difficult to continue. Yes. You are afraid it might hurt. Well, not that I'm afraid, but my husband does not like him crying and tells me to stop. You would like to brush, but at the same time, you want to keep the peace and quiet at home. And you would like to change that. You would like to change the current situation. So notice that it is not important that you guess correctly in the reflection, because if you guess incorrectly, the person will simply correct you. Here I would like to share a little case of mine, the power of reflective listening. Thomas is a little boy who has been referred to me because the own dentist did not manage to change the behavior and his cavities were progressing. Thomas was receiving chocolate 10 times a day. And if I thought, why is that mother keeping giving chocolate to the child so many times a day? What does it mean to her? And then I said the simple statement, I think you are giving chocolate to your child because you love him very much. And then the mother started crying. She said that she is feeling very lonely and she experiences the lack of love, and that's why she would like to compensate that for her child, and for her chocolate is love. So she is going at night to the gas station to buy chocolate for herself because she wants to compensate her lack of affection, and she does not want her child to have a lack of it. So that was her situation. And if we don't understand what's happening with the mother, we will not be able to change the health of the boy. So we sat down with the mother and we did not talk about the teeth at that time. And I only tried to reflect. I said, you really love your son and you want to show him that. You feel lonely and you would like to change that. It hasn't worked out for you yet, but you are really trying to do your best. And then the mother was feeling so understood, and she wanted to do the best for her child. So next time when she came in a month, I did not recognize her. She lost 10 kilos and she stopped giving chocolate to her son, even without me advising her to do that. And of course, we fixed the teeth later. The third skill of motivational interviewing is affirmation. It is like looking at the people through the positive glasses. You try to notice everything what is positive in these people and what can help with the change. You try to show them that you notice that. You try to notice their strong sides and their abilities. You search for them by asking questions and you try to support them by saying positive things. So you give hope to them. And everything what gets attention starts growing. The fourth skill of motivational interviewing is making a summary. You are kind of putting all the pieces of the conversation together, or you pick out the most important pieces. It gives a sign that you have listened to the person, that you have tried to understand. By putting different pieces together, like different flowers to form a bouquet, you can get a different meaning of your conversation. You try to pick out the change talk and the strengths of the people, and you try to ignore the weaker parts of the conversation or the things that didn't go so well. Summarizing helps you to guide the conversation to one way or to another. And by guiding your conversation, you will be able to save time. There's a question, can we give information or advice in the framework of motivational interviewing? Yes, of course we can, but we first of all need to find out whether the person needs that advice, whether the person wants your information. So the simple thing is to ask. Because the unsolicited advice, nobody wants the junk mail, nobody wants that advertisement in their mailbox. So it is the same. If you give advice without asking, It is put in the junk mailbox of the life. So any explanations and solutions that you would like to give, ask for permission. And the technique for giving information is called elicit, provide, elicit. You give small bites of information and you see what does the person think about it. So here's a little example of the sandwich technique. You may ask the person, may I tell you something about fluoride? And if the person says yes, then you will tell about fluoride. But the conversation is not over. It is very important to ask, what did they pick out of your explanation? What do you think of that? That's very simple. So in your practice, let the parent sit next to you and you demonstrate what you see in the mouth. And instead of you trying to explain what it is, you first ask questions. What do you think what that is? What do you know about this? How it developed? Is it okay if I tell to you? And when the parent gives permission for you to tell, then they are open for your information. And in that case, if I see this initial carriers, I take out a picture that I put together myself and I show it to them. And a very interesting metaphor that I find working very well is a metaphor of Jenga spell. It is a tower of blocks and I can compare it. The tooth is also made of multiple towers of minerals, and every time that sugar comes into the mouth and there are bacteria present on the teeth, some blocks are being removed from the teeth. It is just like a thief is stealing diamonds from the teeth. I tell that to the children and they really enjoy that story. Do you want these little thieves to steal your diamonds from the teeth? No, they say, I don't want it. So, if you don't like it, what can you do yourself to stop this process in your mouth? And then they start thinking, and the most interesting solutions come out of this story. And here I have one more example of a conversation. What can you do when the parent says, at this moment, I don't want to change anything or I cannot change anything? This is a case of a mother that has been referred to me with a girl who did not want to allow a treatment in her mouth. She was very afraid and she had one cavity. We sat down with the mother and we started a conversation, and this is what I heard. I'm just divorced and I must take 3 children to school. Afterwards, I run to work. In the evening, I'm dead tired and I will surely not be able to manage to brush their teeth for all of them. And it is really impossible for me to watch what they eat and drink during the day because I'm simply not at home. At that moment, I noticed that the mother became emotional. So I tried to reflect her. Your situation is really difficult. You have so much going on in your life now. Yes, you have so much on your plate, you cannot have anything more. Yes, indeed, that's very difficult. So at this moment, you need support. In any case, you don't want that Jessie gets pain. Yes, exactly. It is important. Then we are going to let Jessie to get used to the dentistry, and you would like us to fill the cavity. Yes, this is what I would like. Okay, we will plan the appointments, but I have one more question. Is it okay to ask? Yes. At this moment, you cannot change anything. You would like to, but you can't. Imagine that in the future there would be a possibility. Is it okay that we maybe talk about this again in the future? Yes, that's okay, said the mother. And this question is called a hypothetical question. This is not putting pressure on this moment, but this is putting things into perspective for the future. So that gives the parents and the people some space to think about. So the mother agreed. And I said, okay, I see that you are a strong person to manage all your duties. So now we are going to make the appointments for Jessie. And we did. And she came back in 1 month. She started brushing for the girl, not every day, but still the process already started. And she already limited the sugars. The girl didn't get so many sweet drinks anymore. So I said, how is it possible? I did not even ask you to do anything, and you had no possibility to make any changes. Well, how comes that you changed? Well, she said, I came home and I thought it over. And I thought, what is most important to me? And she said, because there was no pressure, I had the space to decide myself, what do I want to do? And she made a decision and she achieved the first goals. The next step in motivational interviewing, the next dimension is motivational interviewing processes. Here, during the lack of time, I will not tell you much about it, but I will go briefly into that. All the processes of motivational interviewing are being gone through in each conversation, and they give a certain structure. So each conversation is starting with engagement. It takes usually about 20% of the time in the beginning. It can even sometimes take a little bit longer. It is very important that you get a very good connection, working relationship with the parents so that they feel understood, that they feel that they came to the safe place, that they are being taken seriously. So it is an invitation for a trip. Shall we travel together? Shall we travel together in the journey to the better health? And when you see that the patients are engaged, they are interested, they are curious, they are active, then you can go to the next stage. It is clarifying the topic. You focus on a certain aspect of dental health. And you can let them choose. You can make a menu, or you can talk about it, you can make it on a card, and you ask, what are we going to talk about today? Are we going to talk about the diet, about the brushing, about behavior of your child, or do you have any other suggestions? So, like a guide, you ask, where shall we go together? Which direction? And when you clarify the topic, it is very clear for everybody, what are we going to do today? When the topic is clear, then you try to increase the motivation or evoke. So then you try to find out, why do they want to change? Why do they want to achieve certain goals? What is important for them? What values do they have in their life? And let the people talk, listen to their reasons of change. And only when this foundation has been built, then you can go to the next step, to the planning, to find out, so what are you going to do? When you know why they are going to do something, then you can find out how they are going to do something, and then when they are going to start something. Be precise, talk exactly what, when, and how are you going to do. And be aware of the pitfalls in the conversation, because we are all very eager. We have the writing reflex, we have the noble wish to help, and sometimes we are eager to push the people. Beware of your passion and enthusiasm. You really want to give your knowledge and your skills, but is that really necessary in that moment? Or is it better to sit back and just watch the passion of another person telling you why they are going to change? Also, beware of your high professional skills and your knowledge. You know that, but put that aside because that might interfere to your listening skills. And the most important, don't go too fast, because for that person, maybe it is a little bit scary to make a change. It is like jumping over a very big space. They don't know whether they are going to be able to do that. So make it easier. Make the step smaller. Make the jump easier. Help them. So here's the end of my presentation. I would like briefly to summarize it. The first principle is that we cannot change the people. People can only change themselves. People get convinced by what they hear themselves say, not what they hear us tell them. And here I come back to the little girl of 2. I will show what happened to her. After the mother learned how to take care of the teeth of the girl, she stopped the bottle feeling. She was brushing well. We were observing the situation and monitoring it carefully. And you see here in 1 year, the cavities did not become worse, did not become much larger. They became arrested without even applying any SDF. And in the next year, also, the cavities that were well accessible for brushing did not increase. And in the meantime, the girl became more cooperative. So the cavities that were more difficult to access for the mother, we restored little by little, one by one, in a minimally invasive way. But it is very important that it is not the dentist, but the parents perform the main treatment. Our treatment is just supportive for that. So here is my support for that mother. And after hearing this lecture, what do you think? What is your first step to your own change in the way you are performing dental treatments? Thank you for your attention.